Yes. So, uh, so today again we have with us Dr. Shweta Parida ma'am. The ma'am has come to us and being with FSTN from the very first day of the FSTN Exploration Foundation, and we are very much pleased to have ma'am in every sessions. Whenever we requested ma'am, the ma'am has always said yes to the FSTN. So we are very grateful to ma'am. And again, for this 15 days short term crash course on the space nutrition, we already have three classes, and this is the fourth class and a very special class organized for you all. And this class will be taken by Dr. Shweta Parida ma'am, and I think you all have known her. Those who are joining with FSTN for a long period of time, they are very habituated with ma'am's class, and in the I just can assure that thing, in ma'am's class you will not get distracted for just 1 second only, because ma'am will take the class so pleasantly that it will be very helpful for all of us. So ma'am is I just want to say a lot of has been there to tell about ma'am, but I just want to share something like the Dr. Shweta Parida ma'am is the faculty of Keys Deemed University, Odisha, and along with that, she is a speaker invitee of more than 10 national seminar. She has more than 18 publications, 5 book chapters, and also she has 10 years experience. And she has done her MTech in and PhD in food science and technology. She also have been awarded with Young Professional Award in 2018, and along with that Young Scientist Award in 2022. And we, the FSTN Exploration Foundation, are always blessed to have ma'am in every courses. So, ma'am,
Yes, good evening all. Thank you, Isani, for brief introduction, and I
my
am
pleasure.
pleased to share my few knowledge to be on space nutrition. So it's a good topic, and should I start my presentation? Let me
Yes, ma'am.
share my
Yes.
slide. Hold on. Okay, is it visible to all of you?
Yeah, ma'am.
Yes, ma'am.
Okay. Okay, thank you.
Yes, ma'am.
So, students, first of all, a very good evening. And as this is the nutritional month is going on, so healthy food for a healthy life. So, happy nutrition month to all of you. It's going to just on the verge of end. And so today the topic is on space nutrition. So already you have gone through a lot of things, that what are the generally space food, how it should be calculated, and how the packaging should be done. What are the mode of food that should be given to you to the space nutrition or maybe astronauts. So actually in space a lot of things happens, okay, because the people are going for a longer duration and they have to do nothing, just sitting idle or doing some software related work, and then a lot of things they are facing a change. So based on these things I just want to share my knowledge on physiological and psychological changes during the space mission. So physiological means a lot of changes the people generally face during a shuttle or on a mission when they on the out from the earth, and somewhere in between with gravitational force, without gravitational force. So a lot of things they are facing. So what are the changes they face? So I'm just trying to give a brief idea on it. So, as we know, that NASA, that is National Aeronautics and Space Administration, almost spent $22.6
ম্যাম,
billion
সরি টু
dollar.
ইন্টারাপ্ট, আপনার মনে হয়
Yes.
পিপিটিটা মনে হচ্ছে চেঞ্জ হচ্ছে না। আপনি কি চেঞ্জ করেছেন পিপিটি?
Okay. হ্যাঁ হ্যাঁ হ্যাঁ, চেঞ্জ করেছি।
ওই সেই সমস্যাটা, হ্যাঁ এবার হয়েছে, এবার আসছে।
ঠিক আছে ঠিক আছে,
হ্যাঁ,
আমি তাহলে এই মোডে রাখছি, আমি
আচ্ছা
স্লাইড শেয়ার মোডে যাচ্ছি না।
আচ্ছা, ঠিক আছে ম্যাডাম।
ঠিক আছে, হ্যাঁ। তো so almost it is a very huge amount, $22.6 billion. As we know that means spaceship, its equipments, a little bit idea we know, we all have seen the Mission Mangal, okay, the movie, and in that we have gone through that what a scientist face while thinking about the space, cheap sources, camera, and all, maybe a huge, when the people are going in this in that spaceship, okay. So that's why a lot of research are going on to develop the space food, okay. So out of which, just think about it, the $22.6 billion is generally NASA is spending on this. So space food is a big issue. So as a person, as a nutritionist and food scientist, we should know about all these things, that what actually in advanced form people are doing, and how we have to reach that exact means phase of or maybe the ladder in where we have to go, okay. So the various in this picture there is a lot of mission already. We have covered all these topics, I think, in your previous classes. So the missions are first one from the 1961 onwards. So Mercury mission, then Gemini, Apollo, Skylab, International Space Station, then Mars mission, and all these things. So already we have given the in previous lecture, that is the food that should be given. It should have, it must be freeze dried, and so that it can be easily hydrated and can be orally consumed. Or maybe some of the intermediate moisture products, thermostabilized products, irradiated food, maybe some frozen food, and some foods are natural form, like the food we eat on earth, maybe some soup powder form, or some uh, mixture paste form. Some of the condiments can be given, tortillas type of compound, means food or snack type of product, as well as beverages, okay. But the main thing that require a food, space food, basically its stability, its reliability, its proper reusability, as well as safety and nutrition, and a variety of options, because they are going for a longer duration. So the food should not get deteriorate during that whole mission condition, okay, during that travel time. So the characteristic of the space food should be low in weight, and it should be rich in nutrition. It should have high energy level, as well as it should not have any waste material, and properly sealed, so that the it will be consumed properly. Otherwise, and easy to open, whatever the seal we are incorporating, it needs to be palatable, because I'm going to that point, because in our physiological change, one of the change factor is our tongue is not, as well as our nose is not so much sensible to sense all the sensory attribute, okay. So that's why the food need to be more palatable, more digestible, easily digestible, because the chewing properties, if we chew, it will take hard to means digest. Otherwise, proper for digestion, it should be easily swallowable form, easily chewable form, and the most of it important is your self stable. So it should be stable for, means it has a long shelf life, okay. So it maybe in the in refrigerator type of condition, uh, it is not common. Maybe some of the nowadays we have the, that condition. So space food, which is changing over time, just a brief glimpse on it. So in 1960s, the space food was based on the puree form, basically, and then later on, it is somehow the scientists tested it and then eat the food in space, And later on in 60 to 70s, it is generally dehydrated food, dehydrated milk, coffee, juice, soup that need only addition of warm water, and then we can consume it. Later on in 70s so onwards, so maybe some of the dining room and table are available and in the Skylab mission, and the people are having almost 70 food items on menus with them, and the astronauts, session wise, they have some taste. According to their taste, they can change their dishes for their upcoming mission. Okay. So, do you know the first person who landed in a spaceship for his during the space mission? So that was that is the person, squadron leader Rakesh Sharma. So he was for 7 days space voyage and in the mission during April 1984. Okay, so he suggested that it is very difficult to maintain the health of an astronaut during a prolonged space travel. So it was only for 7 days, but according to his suggestions, some of the implementations has been done accordingly. So complete nutritional intake is simplest if the astronaut merely takes a pill orally as a nutritional supplement, which is not possible because we know that to provide a approximate 2000 kilocalorie energy as per a adult requirement, it cannot be fulfilled in a small pill form. Okay, so we need to work hard to do that in uh, in such a form so that it will be easily assimilated as well as energy rich. Okay, so I think this one is quite hazy for you. So these are some of the stress releasing factor during the space flight. So there may be some of the physiological, psychological, psychosocial, human factors as well as habitat factors. Okay. So I will share the slide. It is just some of the points which I summary of the points that I'm going to discuss. Okay. So coming to the path physiological changes. Okay. So when the nutrition uh, means nutrition point of view, the person or the astronaut or cosmonauts generally feel these type of physiological changes. Okay. So first one is body composition. So in body composition, generally, what are the main factors? Those are get changed. So in body, we have fluid. That fluid imbalance normal, it is generally takes place. Then muscle and subcutaneous fat change and bone demineralization. And apart from that, some of the energy utilization get hampered, endocrine function get disbalanced, cardiovascular deconditioning, hematological changes, effect of microgravity, as well as some other changes are there. So detailed study one by one. So, so body composition or the fluid imbalance mechanism. So generally uh, as per the person, normal person, adult, it is generally seen that there is a decrease in fluid content in approximately 500 to 900 ml in microgravity. Because of the gravitational force get decreased, that's why the fluid accumulation in our body is not well proportionate, as well as there is reduction in fluid quantity. Okay, so frequent urination may occur, uh, as well as sometimes from the plasma volume. So our blood plasma level is also get decreased by 6 to 13%. So the fluid is generally due to the gravitational force imbalance. It is just not balanced in the cell. It comes out. Okay. So there may be, because of the fluid imbalance, there is motion sickness. The person may feel problem in their in locomotion as well as in daily working condition. Then iuresis, that is generally common. and it creates problem, frequent urination during the initial space flight. Okay. So if we see here, as it is given, so the percent of body weight loss, because the fluid is just from the cell as well as from our lymph as well as our blood plasma is get disbalanced. So there is the weight loss in average in every person who are on the space mission. So at least 10% of their body mass just get less during the flight condition. And the other facts, if we see, there may be due to the fluid shift, it is maybe the salt loading, there may be blood pressure may get hampered, changed, and emesis, that is the frequency, the process of feeling of vomiting. Okay, so that may also get exaggerated. Okay. So here in the graph it is shown that if uh, the mission duration in days, so if it is in 20 days, then it is just only in most of the person the flight due to the during the flight and the body mass decrease up to 5%, or maybe when it is increased up to 200 days, so almost it is more than 6 months. So more than 6 months in every cases, in everybody, just a few person have more body weight. Otherwise, the body weight get decreased. Okay, so almost just see in the in above in positive quadrant, it is only few persons, 3 to 4%. Otherwise, the most of the samples or the persons, generally astronauts, have less in their body mass. Okay, whatever the days, maybe in 20 days duration, maybe a 60-day duration, maybe 120 days of duration, 180 days, 240 days, whatever the days it is. Okay. So next is your body muscle. So the body muscle just get an loss of lean body mass and reduces the muscle strength. So particularly it happens in case of leg muscles. Okay, towards our lower part, that means from the thigh and the knee as well as our calf muscle. So those mass get a lean body mass, and the body is more accumulated, or the muscle strength is more accumulated towards the chest and bicep, tricep, those zones. Okay, over the shoulders. So there is generally imbalance in the body mass. Okay, so the factors may be due to the microgravity, as well as the factors may be due to improper food intake, just because of the feeling of nausea, as well as the lack of exercise, because the people are not doing some people. So nowadays it is just, that's why recommended to do exercise in the spaceship space stations also. Then legs are mostly affected, just I told you. And despite of adequate food intake to maintain the lean body mass, generally this type of muscle change takes place. Okay, so the body is unable to maintain the balance in the energy. So that's why, as well as due to the force, the gravitational force, the change in other hormones. So all these ultimately affect the body composition. So now come to the bone. So at zero gravity, generally bones start demineralization. Okay. So the bone demineralization means it starts an osteoporosis type of condition. So the bone becomes more porous, and because of the excessive excretion of calcium and phosphorus from the bones. Okay, that is, so why this may be happening? So this is because of maybe hormones, that is parathyroid hormone, as well as the thyroid hormone is not properly activated, and which ultimately alters the vitamin D metabolism in our body. So that's why, because of vitamin D metabolism hampers, the absorption of calcium also get hampered, and it will release the calcium from the bone, and it will leach out the phosphate molecules also, and that's why the bone strength get decreased. Okay. So the vitamin D status may be related to ultimately fracture on the longer duration. Maybe if a person is frequently going on a spaceship, so there is a chance of fracture due to low bone mineral density, as well as there may be the muscle strength as well as the muscle function fall down. There may be some chance of prostate cancer, breast cancer, or colon cancer. Multiple sclerosis. So multiple sclerosis means there may be some chance of that our means our neuron, this neuron sheath. So in our nerve system, in our nerve cells, we are having axon, introns, and on that we have a myelin sheath. So that myelin sheath get disrupted. Okay, so in our nerve as well as in our brain, so these type of the nerve cells means if the myelin sheath get disrupted, then the or obviously the axon and intron, sorry, the axon and the dendrites, those portions and the neurotransmitter susceptibility, so those will also get changed. So ultimately, our nerve system will get damaged. Okay, for this, for these vitamin D status. Okay, so there may be some heart issues and blood pressure. So there may be high blood pressure, and that lead to heart disease. And maybe some chance of diabetes also. That is type 1 diabetes. Okay. So, the dietary routine also has an impact on our bone health. So, generally on a spaceship, we just consume animal protein. Okay. So, a high ratio of animal protein to potassium also is a problematic condition for bone. Okay. So, that is animal protein to potassium ratio, that is the ratio leads to more bone to be break down. That condition lead to leaching of the calcium and low absorption of vitamin D, and that's why but almost in spaceship, the animal proteins are animal meat are generally in the chunk form, or maybe in the soup for the powder form, or maybe in some case in the meal form. We just advise them to consume, but it should not, the potassium level should be properly balanced if the animal protein is taken by the person or mainly the astronaut. So coming to the next change, that is physiological change that generally an astronaut face, and it is energy utilization. So the energy utilization during the space flight is generally uh, changes because of the food intake get changed. Whatever the balanced diet we commonly consume that get changed during the space flight, as well as there is metabolic imbalance, because all of you are very aware about that this gravitational force is very important for our microbiota. Okay, so the balance in our sorry, the intestinal microbiota get hampered during the that's why the energy cannot be utilized. The proper absorption or assimilation is get hampered. So that's why the energy utilization is also get hampered. Okay, and sorry, enables energy that is from the food, but we get through absorption method. So that is also hampered. Okay, and the respiratory gases, because it is very hard to breathe in the spaceship, and as well as though there is the oxygen cylinders, as well as from the atmosphere, some of the machineries are there to avail from hydrogen and oxygen. They are preparing those gases. Those are generally taken for the water preparation also in a spaceship. But still, the accumulation of CO2 gas, and that will create problem in their energy, proper balance in their energy level in their body. Okay, so the greater use generally before a space flight condition, they use more amount of carbohydrate and lower the use of the fat. Uh, so it is a pre-condition planning, a long-term planning before before a space flight, so so that their body get adjusted and they can accommodate the food or adapt the food and the changes in a better way. Okay, so average energy required is 2000 kilocalorie per day as an adult, but during a work in a space condition we consume only 30 to 45 kilocalorie per kg. Sorry, yeah, that is the 30 to 45 kilocalorie per kg body weight. We need the energy to work in the space. So next, coming to the endocrine functions. So endocrine changes are also associated with the response of our adrenals. So we know that fear, flight, fly, so all these things are related to your adrenal secretion. So increased secretion of cortisol, generally seen in the from the adrenal cortex, as well as increased secretion of epinephrine, norepinephrine from the adrenal medulla happens. Okay. Apart from these endocrine glands, hypothyroidism and hypogonadism is commonly found in the space shuttle condition. So that is low T3, T4 and TSH level, as well as the whatever the hormones are associated, progesterone, testosterone, estrogen, so luteinizing hormones, so those are also get changed, follicle stimulating hormones, so all these get changed during the endocrine, during the space condition, that they are just secreted as normal person to less percentage in the in the during this space condition or space flight condition by the astronauts. Then other than that, the astronaut will face an increased insulin and blood glucose level, as well as the blood glucagon level is higher. Okay, so the pancreas generally secrete more amount of glucagon, and the more amount of glucagon will use more carbohydrate or more glucose is utilized, but they have a decreased metabolic efficiency because their microbiota is not balanced properly. So it will ultimately reduces the urine production also. Okay. So initial phase there is diuretic condition, but later on for a long term, means after 3 to 4 weeks or maybe up to 2 months, so there is generally reduced urine production as compared to the initial phase. Then coming to some of the cardiovascular deconditioning condition. So the cephalite shift of fluid is generally 1.5 to 2 liter. Okay, so it is quite huge amount of fluid shift. That is, cephalite fluid means it is the shift in the space have been hypothesized to cause a space flight associated with neuroocular syndrome. Okay, so space associated some of the syndromes are considered as SANS, and it is increasing the intracranial ocular transmissional translaminar pressure gradient. Okay, so this is the generally the fluid disturbance in our cardiovascular system. That's why we have a decreased orthostatic tolerance, increased heart rate, decreased pulse pressure, and tendency towards spontaneous syncope. Okay, so the breathing pattern is get changed. The love dub and the force of sneeze means taking the air intake and air viswas and praswas, whatever. So those things is not so maintain the spontaneous process to maintain this generally, but it takes more cope up for because of the cardiovascular defunctioning. So in zero gravity, it is also generally there is change in both function of and structure of the cardiac system, as well as there is the movement of fluid from lower extremities to the thorax as well as head. just as I told, in fluid imbalance, as well as it decreases the intravascular volume as well as arterial pressure. And synergistic effect is generally on the heart due to the change in lymphatic, neural, hormonal control system. Okay, so it is very serious issue both during flight condition as well as post flight condition, because these changes are not temporary. These changes may lead to a long term effect in our body. So that's why the astronaut have experienced some of the problems like orthostatic intolerance, cardiac dysthemias, and diminished cardiac function, and manifestation of previously asymptomatic cardiovascular diseases. So this may lead to a hypotension condition, and generally the people are unable to balance to generally proper standing, proper, because their chest is somehow more accumulation of water takes place. So there is very difficulty to balance their body in the space zero gravity condition. Then after this problem, another problem which is very serious, that is hematological changes. So there is the reduction in blood volume, and ultimately there will be reduction in RBC. So in initial phase, first of all, I must clear this, that reduction in plasma volume takes place, but initially the count of RBC get increased. But later on after some duration, the reduction in RBC takes place. Okay. And simultaneously, the lymphocytes will get migrated to the lymph nodes, and but our erythrocyte hemoglobin count may be constant. Okay, so by checking our blood CBC test, we may not found a hemoglobin percentage change, but there is change in our blood plasma level as well as RBC level. So some of the immunological changes may be like T lymphocyte reactivity may get reduced, as well as some of the serum cytokine level get altered, as well as natural killer cells, granulocyte, monocytes. So these cells, blood cells, may also get changed during the uh, during the space flight. So if we see the effect of microgravity, it is showing that the space motion sickness as well as produces malaise, headache, anorexia, nausea feeling, vomiting feeling. So these are generally common in every person, whoever it is a lady or a gents, or maybe some a new person, or they already have gone for them several times, and then he or she is going to on a space mission. Everyone feel the same thing for 2 to 7 days, all four symptoms. It is common in all the space persons. More than 50% astronaut experience this problem, but almost it is seen that for 2 to 3 days, means almost for 3 to 4 days, all are facing the same problem. Maybe for 7 days, it may not last till 7 days. Some other changes, if we will going to see on that, so there is gastrointestinal changes already, that is, or I told you before, that the microbiota is get hampered. Then the loss of appetite, uh, the people will not get proper absorption, their enzymatic action is not properly balanced, so that's why they may feel loss of appetite. And gas formation in stomach is very often happened, and the taste and odor sensitivity also get changed. Then apart from this, some of the other changes like immune system get changed, that is adaptive immunity, alteration of cytokine, peripheral nucleosides. Then CNS may get changed, maybe our brain areas get a lot of variations. Then our automatic nervous system also get changed because of stress. Then the skeletal system is also facing the bone loss, it may affect our eye. So eye, there is maybe some chances of the flattening of eyeball, optic disc edema, as well as nerve fiber layer necrosis. And because of the low RBC count, the people may feel anemic. And there is just here it is written that the increased red blood cells. I just told you that initially the red blood cells get increased because the blood plasma get lost. The fluid, so the fluid exchange, there is blood plasma loss there. That's why it is increased RBC. Okay. So later on, the RBC get reduced, and the people may face anemic condition. Okay. So it is ultimate condition of a body. So the generally we feel our inner ear also disable, means it loses its balancing property, and generally the eye becomes the principal organ to maintain the equilibrium. Okay, that's why our eye are facing more pressure, and that's why their aqueous and the liquid, those are inside your your retina. Okay, so that humor get pressurized, and it may create problem. Okay, and later and similarly the immune system get weakened, blood plasma levels get changed, people may feel anemic, then the supporting bones and muscles face an atrophy, and our touch, feeling of touch from our toes particularly, and from the lower limb, it get uh, reduced. The touch and pressure receptors are no longer exposed to gravity, so they are just uh, feeling of, means that they are just inactive in form, and the way the sensitivity get reduced. Okay, and the body fluid generally shift from the lower to upper side, so that's why your legs becomes more thin, renal filtration get hampered, the flow may get increased, uh, and the radiation may cause any type of the cosmic rays, but basically that is present in the galaxy. So a lot of cosmic rays are generally cause a lot of cancer condition, that may be um, any type of cancer, and the body fluids shift from lower to towards chest and head, and modified sensitivity causes confusion and disorientation. So the brain may not work properly for a long term space shuttle mission. So these are some of the physical factors in space and their effects. So already we almost uh, discussed everything. So there is the change in the cell structure and differentiation due to the microgravity. What are the things those are happening? And for radiation, what are the things are happening? So that is enlisted over here. Okay. So due to microgravity, there is the change in the cell structure and differentiation. There is altered in immune response, impaired tissue repair conditions, cardiovascular problem, dysfunctions, then sensory motor alterations, space adaptation syndrome, cognitive dysfunction, and eye disease. Then coming to the radiation, the outcome of radiation, that is because they may lead to bone loss and fracture, cardiovascular problems, carcinogenic problems, cancer, any type of cancer, CNS, central nervous system get changed, then memory impairment, then altered executive functions and visual disturbance. So how one should monitor astronauts' health, that is in a space condition. So here it is a number of tests. Those are generally taken uh, in emergency conditions. So those facilities may be available. I am not sure about it. So electrocardiography, ultrasound examination, cardiorespiratory fitness evaluation, blood pressure checking, measurement, biomarkers of cardiovascular disease, glucose metabolism, inflammation. So those are related to hematological alteration or body fluid alteration implication. Similarly, for immune response, the tests are blood immunophototype analysis, C10 function evaluation, blood cytokine levels were analyzed. Then kidney stone or any urinary related problems, generally urine, ultrasonography, urine pH level, and urine biomarker levels were checked. Okay. Then for muscle atrophy, electromyography, muscle strength, bioimpedance, and muscle biopsies may be carried out. For bone demineralization, we generally do, it is very common, bone densitometry and blood urine calcium level, uric acid level, and blood biomarkers for bone and calcium metabolism. So those are generally thoroughly checked. Then for gut microbiota alteration or it is healthy, so for that generally breath test and ultrasonography is carried out, and as well as some peptides were checked in the blood level, that is ghrelin and leptin, and whether the body is exposed to any ionizing radiation. So for that, blood microRNAs and gene expression profiling, cytogenetic assays are carried out. So cephalic fluid shift or the nerve system variations are generally analyzed by neuroimaging analysis, measurement of intracranial pressure, evaluation of ocular structure, blood stress hormone level, as well as cognitive performance tests. Then coming to the psychological problems. So there is huge emotional and interpersonal issues during a space flight condition. So the space astronaut generally face a lot of conditions, particularly there is change, altered circadian rhythm, their sleep get disturbed, their neurocognitive impairments, and they feel fatigue. Okay, so circadian rhythm means the biological clock. That means the body is adapted to a particular pattern. इस टाइम सोना है, इस टाइम उठना है, इस टाइम भूख लगता है, इस टाइम खाना है. So that is a pattern generally we manage to do in our day-to-day life. Okay, but that gets changed. Okay, so that's why there is the problem in their balance, in their emotion, and they feel stressed. Apart from this, there is asthenatization. So that includes the irritability, emotional liability, and attention and concentration difficulties, and appetite. That may be appetite uncontrolled. That means it may not have appetite, or maybe means irrespective of time, it may be changed. Okay, so the generally it is common in astronaut. So other than that, some of the problems they are facing, so particularly depression, insomnia, proper because of the sleeping pattern get disbalanced, and attentional deficit. They need a proper family attention to talk somebody close people. The mood instabilities, um, generally immune system get irregular, and maybe some of the physical illness may occur because of all these things. Okay, and some of the common side effects for a long term isolation condition: inattentiveness, mood instability, sleep disturbance, perceptual distortions. So all this may happen. So privacy is another big issue, okay, because there is no separate room for each and every person, and then if a person needs a proper privacy, so that is generally not possible. Okay. Then disorientation. So the disorientation, that is uh, there is no choice, that you have to go from one place to another place. जैसे कि हम लोग घर पे होते हैं तो मन किया balcony में थोड़ी देर खड़े हो गए, फिर टीवी देखने बैठ गए, फिर सोने चले गए, बेड में लेट गए, सोफे पे बैठ के मोबाइल स्क्रॉल कर रहे हैं. So all these things may not happen. Okay, but still there is network connections. I don't know whether it is not network exactly, but they able to connect with the people from the earth, and they can talk to their family members, but it's not so frequent because in the space there is, they may not know about the time, particularly अभी morning है या शाम है या सुबह है, वैसा कुछ पता नहीं चलता वहां पे. ओके, क्योंकि वहां पे सूरज दिखता नहीं है कि अभी हाँ इस डायरेक्शन में है या उस डायरेक्शन में है, तो इतना बजा होगा कुछ पता कर सकते हैं. ओके, so that is a quite different thing with generally a person face, because we never seen, we never felt, it's only in our imagination that maybe this happening. Okay, so this, some of the other things I just it in a summarized form it is just here. Um, so the psychological problems generally include during the space flight associated with the stress factors and the consequences on our brain health. Okay, so the microgravity ultimately create problem with the brain structural, functional and connectivity modifications, sensory motor coordination, uh, maybe neuroocular syndrome may happen, space motion sickness, maybe due to radiation there is synaptic problems and altered, and then some of the, and because of the galaxy environment, the, or maybe the specific environment, there is the increased CO2 level, high cortisol level, anxiety level get increased, depression level get increased, the loss of appetite, the apathy, circadian rhythm get disturbed, sleeping pattern get disturbed. So there is a lot of sleep problems. Then psychological state, there is mood swing, and some of the sensory motor get decreased or accelerated form, and then some of the cognition problem and neuroplasticity. So neuroplasticity, that is maybe enhance neural synaptic strength, boost some recovery from lower extreme dysfunction, and so that is the generally pre, post, in-flight condition to Moon or to Mars space flight condition the astronauts are generally facing. So, what the space food need to be designed in what way? So, the space food should be normal, uh, that is generally given to in a normal form before the mission to an astronaut. Then, according to the physiological change soon after arrival in the space, there may be some of the physiological change. So, according to the change in physiological condition, the food should be uh, given in such a way to maintain the fluid imbalance and to increase the palatability, to prevent the loss of appetite, as well as uh, to uh, to balance the sugar level in the body. Okay, so later on, then the next phase comes, that is a stable form. Okay, so while after arrival in a space, that is a stable form. So during that phase, it is quite stable. The body gets acquainted, adapted properly after certain duration, and and soon after return to the earth. After that the whole space flight, when the astronaut return to the earth, there again there is some of the physiological changes, because the from out of the gravitational force to coming back to a gravitational force again to a normal life. So again there are some physiological change. So soon after they return to the earth, their food should be modified accordingly, so that they will feel good. They will feel proud that whatever they are serving for the world, and and later on they will face a recovery phase, and that is uh, full of energy, full of positivity and full of enthusiastic condition. Okay, so ultimately, so these are the things we need to look after for a space food. So the nutrient requirement include proper balanced energy, good source of fiber, fat, protein, fat soluble vitamins, water soluble vitamins, proper balancing minerals and fluid. Then that should be designed for balancing the systems like preventing the demineralization of bone, balancing the muscle wasting, and balancing our cardio fluid and electrolyte balance. It should boost up our immune system. It should be good for our nerve cells, so particularly endocrine system performance, and gastrointestinal microbiome is not so strong, so we have to look that so that our gastrointestine should be balanced properly. Then simultaneously, the food should be rich in amino acid components, proteins, sodium, essential fatty acids, antioxidants, vitamin D, vitamin K is also important. Then because it will balance the blood, that's right. Then some of the phosphomolecules and calcium molecules, citrate salts may be given. Proper medication or exercise should be advised so that uh, the system will get balanced form. Okay, so on the B mission, we cannot change the radiation activity, but according to the duration and, according to the time schedule, so the food system should be divided. Okay, for breakfast, morning, lunch, dinner, snack. So whatever the food system, it should have different category of food, and it should be uh, very tasty and tempting for the people. So the space food need to be safe, full of nutrition, stable, palatable, reliable, more variety, options, and user friendly. So this is the summary of the thing. So the astronaut need uh, generally a right amount of energy and nutrient, lightweight food and compact food, as well as the food should be enjoyable, and it should be prepared very easily, quickly, and it will last throughout the mission, okay, for months together or years together. Okay, so probiotics should be given in the should be included in their diet. So because of the probiotic, there is that their gastrointestinal condition will be benefited. There will be more absorption of the minerals, and there will be less energy related issues, and the good digestion will be there, and it will lead to proper balance in cardiovascular system, bone, good for bone health, as well as it will protect from various carcinogenic agent by radiations, and it will also ultimately improve our brain or psychological emotional health. So that's why generally probiotic foods are included, and it is produced by ProLab. I have just gone through this site. They are providing a number of maybe some in the bar form, in the powder form to be incorporated in the soup and consumed. They are providing some nutrition bar as well as some drink form. They are providing these products from the product company. So now preparing the food, generally, before we go for a preparation, the astronauts are generally prepared before 18 months. This thing means now we are in mid of 23, so in January 2025, if someone going for a space flight, so it is already the countdown has begun for them. So the astronaut should undergo the test for the picking up the good food for the space. And before 5 months, the astronauts, along with the nutritionist, choose what should be there in their menu. And when it is 3 months to go, the menu are finalized and given to the contractor for the preparation. And when it is 1 month to go, the food is properly cooked, maybe thermoform or refrigerated means freeze dried form, whatever, or irradiated form, whatever it is. Then before 2 to 3 days, the food loaded into the spacecraft, and it is time to for the flight. And again, so the astronaut get the food properly during their flight. So remember the space. So what is space? So space stands for strap down strap the tray and cutlery down so that it won't float away. So generally they use a small tray along with their cutlery, means a spoon as well as chopping knife, and the food should be processed and stored for a longer period of time. The food should be appetizing and it should be less crumble, like any type of crumbs. Generally, we have in various patties, so that or bread crumbs. So it should not be crumble and easy to prepare. So that is the full form of space. Okay? So the last, that is the future trend of space food include a new generation, that is high technology 3D food printers. I think it is very new, and it is now the astronauts are planning that the raw ingredients should be taken by them, and in the 3D printers they will be able to design the food according to their desire, as per their nutritional need, as per their taste requirement. Okay, so these include some of the slurries, additives, some nutrient capsules, or maybe powders, and they will prepare. So each individual ingredients can be stored for a longer shelf life, and it will be not an issue for self stability, and it will boost up the nutritional, or will provide all the nutritional properties, and it is blended in such a way as per the software mechanism. It will reduce the quantity of food, and as well as the food can be easily available in whatever the desired quantity or quality level. And the meals should be designed according to the nutritionist condition. It should be compact. It should be, if it is in the bite form, chew form, so it should be small sized, crumb free, easy to consume, energy dense, and self stable. So, this is all about the space food. I think I'm able to somehow enlighten you on the changes the people uh, facing during their space mission. They are doing a very great job, and a small try we are going to understand that what they feel during their flight condition. So thank you all for your present hearing, and
Thank you. Uh, Thank you so much, ma'am. Your topic was so innovative and wonderful, and we have gained lots of knowledge about space, food, physiological changes, and psychological changes of astronaut. Yes, we should know about psychology of astronaut, because we know that psychology adversely affect on our human health directly. So thanks again, ma'am. So student, if you have any questions, please ask to ma'am in Bengali, in Hindi, and English language. Okay? You can
Ma'am,
write
in
on the
space,
chat box. Yeah, Aparajita.
okay.
ma'am, is there any problem of menstruation in the lady astronaut?
Obviously, astronaut they must face the menstrual problem. It is the natural cycle. Okay, so menstrual problem as such reproductive organ के ऊपर ऐसा कुछ मिला नहीं. I think that uh, there is less secretion of hormones, so that's why there must be imbalance in their hormones. Okay, so there maybe must be irregularities, or means irregularity in their monthly period as well as their flow. I think there must be some changes because it is hampering our normal hormones like epinephrine, norepinephrine, cortisol, insulin, and it will obviously that it is hampering the menstrual cycle also.
Okay, ma'am.
So someone has asked that why eye disease occur due to zero gravity, why the population of microbiota changes. Okay, so what happens? First thing, microbiota change. So due to the hormonal change, the enzymes are not actively participate in the food degradation. Means the whatever the amylase, the protease, lipase, the enzymes are present in our gut microflora, they will not degrade it properly. Okay, so if it is not in a simpler form, if the protein is not degraded into small peptide form, the intestine microbiota helps to assimilate this in a proper way. Uh, and means particularly the dietary fibers and the complex polysaccharides, the those are basically assimilated in our gut microflora, and the bulk the amylase is not so means the enzymes are not so much active, so that's why they are not able to degrade the carbohydrate and all, and it will ultimately the complex form of sorry the complex type residues of fibers as well as the complex peptides, so those will directly create a poisonous, not poison I will say, it will be create a toxic environment for the microbes. Okay, so the microbes are not getting the enough food for their growth. Okay, because the simplified form they will degrade it or cleave it in a simpler form, more simple way. Okay, so if it is in a huge molecule form, the microorganisms are not getting sufficient food in the microbiota, so that's why the unavailability of certain food, they will lead to decrease in microbial count. And once there is decrease in microbial count in our microbiota, it will the symbiotic association of the microbes will get hampered. The disbalance will occur. So যেটা মানে ছিল সেভারাল মাইক্রো অর্গানিজমস যখন ছিল, তো সেইটা যদি একটা হ্যাম্পার হচ্ছে সিম্বায়োসিস একটা ক্ষেত্রে গিয়ে সেটা আরেকটা কোনো মাইক্রো অর্গানিজমের কাজকেও প্রিভেন্ট করবে। তো সেই নিয়ে যে ব্যালেন্সটা ছিল সেই ব্যালেন্সটা থাকে না। জিরো গ্র্যাভিটিতে চোখের জন্য কি প্রবলেম হয়, তো চোখে এই অসুবিধাটা হয় যে যে যখন আমাদের মানে ইনার ইয়ার পিন্না মানে মিডল ইয়ার, দেন ইনার eardrum, then cochlea. So that portion is important for the fluid balance in general human body. But what happens, the fluid get accumulated in our thorax region, and the ear is not much enough sufficient organ at that stage to balance all the fluid. Okay, to maintain the equilibrium, balancing the equilibrium condition can. So that's why the eye, as it contains the fluid inner inside means lens, aqueous humor, and vitreous humor. So on that, the fluid accumulates towards the upper side, as well as the problem with the eye is the fluid, the, the all the body fluid get changed, and from the inner eye, the eye get the fluid pressure. Okay, because the people are not standing just in a straight way. Okay, somehow they may be tilted in some angle, and that's why there is some change in their fluid balance. Okay, so that's why the eye cataract problems may occur, maybe some the dryness in eye that may occur, and some other problems also associated with eye, means because of the imbalance in the fluid of our eye. Okay, so that's why that will create problem in eye, and the microbiota population, that is because of the hormones get changed, the enzymatic activity simultaneously will get changed. The simple food will not be available for the microorganisms, and that's why the complex form may not be degraded properly, and that may be in that environment some of the microorganisms may not be able to grow. That's why there is the change in the microbiota status in the GI tract.
Thank you, ma'am.
I think it's clear.
Yes, ma'am. Yes, ma'am.
Anyone?
Students, I think, ma'am, they have no questions. So, thank you, ma'am, for my FSTN Expression Foundation for your lecture. Thank you so much, ma'am. Now, student, you
Yeah,
can
I will
please.
share the slide so that
Yes,
I
ma'am.
will note down. Yeah, that's
Yes,
right.
ma'am. Yes, ma'am. Absolutely. Okay. Good night, ma'am.
Okay, thank you. Thank you, FSTN Editorial. Thank you, all the students, for participating in this program. And I think I will look forward to see you in other programs also. So thank you all. Thank you, Sobit, and all the FSTN members. Keep it on going. Keep going on.
Thank you so much, ma'am.